Good afternoon, everybody. My name is Julie and I am the Director of Fundraising here at Centrepoint. Welcome to this afternoon's talking point. I'm delighted that you're able to join us, and thank you so much for taking time out of your lunch hour. I'm really looking forward to today's session where we'll be focusing on mental health. I know it's a subject that you, as some of our most value supported, are really interested in too. We've had record numbers registering for today's session. We've had nearly 180 of you, and I can see that there's over 100 of you on the line at the moment. And it's great that we're kind of talking about a topic that everyone connects with so much. You'll be hearing from the absolutely brilliant Sue Kellie, Centrepoint's National Head of Health. I am so excited for you to have the chance to hear from Sue. She's an absolute tour de force, so passionate and such an incredible source of knowledge. I think she's a really great example of the amazing commitment of our colleagues who are working with young people. So Sue today is going to be talking us through how our young people are disproportionately affected by mental health issues and how Centrepoint's unique services support them. She's also going to talk about a little bit about the impact of the pandemic and what our plans are, the future are, so we can make sure that we do have the most impact. Sue's going to be talking till about 12:45, so about 15 minutes, and then what we'll do is we'll open the floor for questions. If you have got anything as you're going through, please do put your questions in the Q&A box at the bottom of the screen or at the top of the screen if you're using laptop. So not the chat, but please use the question and answer box. And what I'll do is open the floor afterwards after they're finished. But let's hand over to the main event. That's enough from me. And I'm delighted to hand over to Sue for her to share her insights, her wisdoms and reflections. Sue.
Hi everyone, I hope you can see and hear me. Thank you so much, as Julie's kindly said, for joining today. I really hope that what I'm going to share with you over the next 15 minutes, I could go on longer, but hopefully what I share with you in the next 15 minutes really connects you with the subject matter and allows you to see just how special our mental health services are in Centrepoint and how proud we are of them and how proud I am of them as well. I think right now all of us in some shape or form have experienced a mental health issue, or at least we've noticed, our own well-being fluctuating as a consequence of the pandemic. So hopefully this will really connect you and you'll find this interesting. So Centrepoint has been specialising in a homelessness and health service for the last 18 years. But it's only really been in the last 8 years, I would say, that we've really refined and retuned our offer and expanded our counselling services and our mental health crisis support services. As Julie mentioned, Centrepoint young people are disproportionately affected by mental health. So we think that almost 60% of our population in our services have experienced this issue. And that is against sort of a national average of between 10 and 20% of young people of the same age that experience that issue. So you can see just how much of an increase that there is in our young people that are coping with these problems right now. People who've experienced or are living in a hostile environment are also 8 times more likely to suffer from a mental health issue, and a third of Centrepoint young people have a formal diagnosis, and that's often sort of severe depression or severe anxiety. So the reason for why our young people are more affected by this issue is, I'm sure you'll all understand that homelessness, that the very nature of it is traumatic in itself. Having to think about where you're going to live, having to think about where your next meal is coming from is traumatic in itself. And nobody should have to feel that way. And so young people have that fear of knowing, of not knowing where they're going to live. They have that fear of not having that regular income stream. So all those kind of issues really have an impact on how you feel about yourself, and how you feel in terms of your self-esteem and your confidence. Also, 50% of our young people come into our services as a result of relationship breakdown. So they are often coping with very difficult family backgrounds. And 48% of our young people have also had experience of being in the care system. So which means that things like multiple placements and that transient moving around a lot has a real impact on your feelings of self-worth. Abuse and witness and domestic violence, again, are two quite significant issues that our young people experience as well. So package that all up, and it's really quite hard hitting. So it's no wonder a lot of our young people really struggle with their mental health. And also adolescence. Adolescence is hard enough without all these other issues going on. So why are we different? What is it that's special about Centrepoint? Well, the key thing is that our mental health services are designed by young people and for young people. So we haven't decided what we think they need. They've told us what they need, and therefore we've created the services off the back of that. So we don't have a one size all approach. We recognise that every young person is unique and is different and responds differently. So that means that we spend an awful lot of time building trust and rapport. As I've said, young people who've been in and out of the care system, they can often have a real mistrust of services and professionals. And, also the trauma that they might have experienced. So it takes time to build up trust and build rapport. And for us, that's the key part. We recognise that it can take us 6 weeks or longer, over perhaps 6 sessions, to really get a young person to connect with us. And that time is special, where we really get to understand where a young person is coming from, and we really connect with them. So that's quite different. It's quite a different approach in that if you have ever accessed a counselling service externally, what you often find is you get 6 sessions from start to finish. And that's often true of a statutory service. And because our offer is so unique, we recognise that it takes us 6 sessions to even build the rapport, never mind do any formal treatment. So that is really quite different. We offer 24 sessions, 24 counselling sessions. Again, the national average is 5 to 6. We really aim to see young people within 2 weeks, and that's against a national average of 4 months or more. And actually, if young people don't want to talk to us, that's fine. We employ so many different techniques to engage young people. So that might include using phototherapy, using art therapy, using bits of drama therapy, because actually sometimes retelling your story over and over again can be traumatic in itself. So this is where our practitioners will use so many different approaches and really try and find the one that works best for our young people. So how has COVID impacted on us? Quite significantly, really. Our, not just on young people, but our staff and the way in which we operate. Everything has moved to virtual ways of working. So rather than being able to see young people face to face, we are now supporting young people over the telephone or over things like Zoom. Whilst it's brilliant in that we can still retain a service, we've really struggled because seeing young people face to face is our bread and butter. It's what we do. It's what we're trained for. And actually being able to see a young person physically can give you a lot of clues as to how they are. Sometimes, just kind of asking somebody how they are and hearing their response often doesn't tally up with how they physically appear. So we need to see young people to be able to really get an idea of how they actually are. We initially thought that there might be a drop-off. We thought, moving to this way of working might actually mean that young people will kind of feel like this isn't for me. But we've actually seen a 40% increase in our referrals. And that means that the waiting lists have increased, which is testimony to all services, and demand outstripping supply at the moment. So our unique selling point was always being able to fast track young people into services within 2 weeks. But unfortunately, we're at about the 3-month mark, which does worry us, because we really want to see young people sooner rather than later, because the quicker we can support them, then the more chance we've got of really intervening at an early stage and preventing young people's mental health from exacerbating. So it's also true to say that, interestingly, young people who live independently, so our young people who live in our independent living accommodation or perhaps our floating support accommodation, have actually been more hard hit by the pandemic, mainly because they are not living in hostile environments, so they don't have that, team around them all the time. So obviously, their feelings of isolation has really kind of crept in, which is quite an interesting dynamic, because normally young people's mental health needs are normally much higher in that sort of hostile environment. I wonder if, what I'd probably like to do is just to share some feedback and some comments that young people have said to us during the pandemic, because I think that really kind of hopefully really sort of shares the experiences that people have been through and makes what I'm saying come alive. So, so starting off with, my NHS counselling has been cancelled because of the virus. So you're the most consistent thing in my life right now. I've been a complete wreck, but I'm just taking it day by day. I miss work and the interaction that I have with others and the sense of value I get from going to work. I feel stable, but I'm worried about my friends and my family and people around me dying. I have social anxiety and rarely leave the hostel, but I have to go out for food, so this frightens me. Pretty kind of hard-hitting stuff. Our young people have really struggled in the pandemic, and we've seen anxiety levels increase. And our counsellors have very much been there as much as they possibly can for our young people. And we are thankful that we have such an amazing team of 30 practitioners that are really working, at all times of the day, to really make sure that we are there for young people. And that just because we're in a pandemic, it doesn't mean to say that we're not there. We might not be there in person, physically present, but we are there over the phone and over video link. So it's been a roller coaster. It's been a roller coaster for our staff. As you can imagine, working from home, but then working from home and supporting young people is pretty tough. Counselling young people at home means that often after you've finished a session, you are left with the worry and the concern. And when you are in a team environment and when you are next to your colleagues, you can share things. You can share those issues or those worries. Whereas when you're working from home, it's very difficult to switch off. And that's a lot of what our practitioners are telling us, that home life and work life seems to very much be kind of blurred into one at the moment. However, we feel there is light at the end of the tunnel. We have amazing services, amazing staff, and we hope that as soon as we are all vaccinated and the virus decreases, that we can get back into our hostels and get back to doing what we can see as the real work, is actually being there and being with our young people. So hopefully you have found that interesting. There is so much to say about our health offer, and this was very much top lines. But I would welcome any questions, comments would be lovely.
Brilliant. Thank you so much, Sue. And I'm sure I speak on behalf of everybody who's listening, is that was incredibly powerful. And those words that you read from those young people were incredibly moving. And I think if the aim was to bring it to life, you really did that for us. So yeah, if anybody would like to have any questions for Sue, any comments, if you could please type in the Q&A box and I'll kind of pose them to Sue. So some are coming in already.
Okay.
Andrew is asking, when you say sort of 6 sessions, how long are the sessions themselves? Are they 30 minutes or are they longer? Do you want to tell us a little bit about the structure and the shape of them?
Yeah. So they can really be, I mean, they vary, but it wouldn't be 30 minutes. It's normally about an hour. But actually, in some instances, I think I may have went off the screen there. In some instances, it might be a bit longer. It's really about what young people need at that given time. But it's on average, it's round about an hour.
Brilliant, thank you. Will asks, how does somebody contact Centrepoint if they have no access to the internet or mobile? And do you have plans to offer help in other cities other than in the ones you already serve?
Yeah, so our health services at the moment are only available to Centrepoint young people. So basically, any young people who are living in our accommodation and support services, the way that they contact us is through Health Referrals website, or through their housing key worker in services, or they can directly refer themselves. So unfortunately, we don't offer our health services wider to the wider population. That's not to say we wouldn't, if it was vulnerable young people and young people at risk of homelessness. So at the moment, it really has to be a young person who is in Centrepoint to be able to contact us. And sorry, and the second part was?
The second part was, and do we have any plans to offer help in other cities other than the ones that we're serving already?
Yeah, I would love to. We have a lot of ambition and drive in the health team, and we would love to. We have already a lot of our services at the moment are funded through fundable income, but we have managed to gain some statutory contracts as well, and those have been in Westminster, in Haringey and in Lambeth. But yeah, we would love to work in other cities and expand our reach. So yeah.
Watch this space. Lynette's asking, is there an age limit to who you support?
Yeah, so it's young people aged 16 to 25. However, what we do is when young people leave Centrepoint and they move on independently, so say they move onto their own accommodation, we will still check in with young people 6 months after they leave with us, because we know that transitional period is really crucial. So say a young person left us at the age of 25, we would still make sure for those six months after and just check in with them and to make sure that they're okay.
Yeah, and I think that aftercare is kind of so important, just rather than kind of, just kind of that support tailing off. So I think that's, so crucial to make sure that it's sustainable and the support we've given them. Yeah. Marvin is asking, I don't know if it's more of a comment or a question, there will be situations when clients may require access to primary medical care and or mental health services.
Yeah, absolutely. So we know that we can't do everything. We have to work in partnership. And we have to work in partnership with those young people that have, very, very severe high needs that need medical and clinical support. So we know our niche, which is we offer counselling and crisis support. However, we absolutely do work with those statutory services where our young people might need more intensive, for example, forensic support. Or more intensive support where it might be that they might need to be sectioned or more of that kind of clinical response. We very much kind of know what we do, and there are limitations in what we do. And so we do call on our experts and our partners to offer that full rounded approach.
Brilliant, thank you. Rob's asking, would it help for business owners to have chats with the young? What's your thoughts on that?
Yeah, I mean, from an employment perspective, I think it's always great from young people to hear from people that are, you know, that have their own business and perhaps have built something up from scratch, or that there is always things that I think that I think are useful to share with young people, and you know, and those kind of things often, you know, help young people's confidence and self-esteem, and perhaps ambition and drive to perhaps think about something like that themselves. So I think there's always room for things like that, particularly in a sort of mentoring perspective.
Yeah, there's actually a few questions coming through about peer mentoring and can we doing. I'm kind of flicking as you're talking, Sue, but yeah, I think there's kind of lots of questions around that. So I'm sure people are, you know, interested in hearing that as an answer. Chris is asking, you know, you say we've got a 3-month waiting time. So are we able to deal with young people in crisis now? What happens to those young people who are kind of literally kind of really suffering with that mental health issue?
Yeah. So the 3-month waiting list is mainly to do with our counselling offer. So our counselling offer is that longer term bit of support. Whereas our crisis support, we are still, thankfully, we're at a tipping point, but we are still able to respond more or less immediately to to those sorts of issues. And also, you know, we recognise that particularly in the pandemic, that young people's needs have increased as well. So we need to be able to still respond quickly. It's more our counselling service that's really been hard hit, I think.
Yeah, and I think that, funnily, I think you've just preempted Kathleen's question that was on the next one in the list about, is it the lack of funding or the professional teams being so busy that that means the time has moved from 2 weeks to a 3-month start, and it's literally just the impact of the pandemic, isn't it, that we're really seeing that?
It is, and you can never have enough resource in this subject matter, never. And you know, we've seen in the press we're potentially on the cusp of a national mental health pandemic next. So what's happening in Centrepoint is just mirroring what's happening externally. So unfortunately, we are struggling in that domain. But I think 3 months isn't great. But I have heard in some instances externally it can be up to a year or longer. So yeah. It's not.
Yeah, I think we know that, and it's, you know, we know that we're trying to do, you know, working through the caseloads as, you know, as we can, but it's just the nature of the pandemic. Corinne's asking a really interesting question to take the conversation in a slightly different direction. What happens if you come across a safeguarding issue during one of your counselling sessions?
Yeah. So when we work with young people, from the outset, we have a counselling contract with them. So all our psychotherapists and counsellors are all members of the British Association of Psychotherapy. So they all have their own memberships to those professional bodies. So obviously that means that at the start of the counselling relationship, we have a contract with young people, and we very much state right before we actually start sessions that in the event of a safeguarding issue, such as if that young person is a risk to themselves or to anybody else, that we will have to share information. And we're very, very clear with young people at the beginning in what instances we will share that information. And also what's important to note is all Centrepoint services, the majority of our services are commissioned by children's services. So immediately there is that instant connection with safeguarding teams. So in all our services, we have a relationship with every safeguarding team, and can in sometimes be part of their local safeguarding boards as well. So yeah.
Yeah, it's a really, I think it does. I mean, it's just a really robust process to making sure that we are kind of making sure that those issues are flagged and that we're able to appropriately follow up on them. It's great to see so many questions coming through. I can see there's sort of 25 still left on the chat. We've got about 4 minutes left, so I think we've probably just got time for one more question, Sue. And I'm just going to, so for those of you who've asked questions that we're not going to get a chance to answer, don't worry. What we'll do is take them kind of and make sure we're sending around answers to all the participants afterwards. So if we don't get a chance to answer your question, please don't worry, we'll come back to you and make sure that we have an answer for you so you can learn more about our services. But yeah, it's brilliant to hear that you're kind of also interested and engaged. And I guess the question I'm going to end on is from Charlotte. And just, I guess it's, how are we managing to offer alternative therapy sessions such as art or drama at the moment with those restrictions? Are they still available to people?
Yeah, so it is a little bit tricky. The art therapy, we have kind of still sort of been able to do it in that when we see young people over a longer period of time, what we have been doing is trying to get in the services workbooks or particular bits of I don't want to use the word homework, but we've been thinking a bit more creatively around what young people can do in between sessions. So that might be practical things like drawing or using bits of art in their accommodation environment, and then us talking about that in their next session. So we're doing a lot more kind of, because we're virtual, it's actually involving a lot more planning, which in some ways is great. So yeah, but it does make it more challenging, particularly drama therapy, when you really need to be in the room with that young person.
And do you think even these alternative therapies, are we still getting the same outputs that you would get sort of in real life as you are doing online? Are you still from those alternative therapies?
So rather than sort of seeing them as alternative therapies, what we do is our psychotherapists, it's almost like our psychotherapists come with a framework or certain techniques or models that they might use. So the phototherapy or the arts therapy will be a model that they use alongside other more formal parts of counselling. I knew this would happen. My dog barking.
Your dog saved that bark until the final 2 minutes before the call, so don't worry.
Yes, I think it's the outcomes for us are really about reducing the severity of young people's symptoms, and that for us is something that we capture every month. And of course, no young person's journey is linear. Nobody says it goes up and down. But that is one of the tools that we use in terms of capturing outcomes.
Brilliant. Listen, thank you so much. We're nudging up to 1 o'clock and the end of the call. So I'm sure I speak for everyone, Sue. Just thank you. It's been so insightful, and I think just really moving from the way that you've talked about, everything that we're doing with our young people and the difference that we make. So I know I speak on behalf of everyone when we just really appreciate the time you've taken to talk through it. Thank you to everyone who has joined on the call. We had over 130 people, and that's just phenomenal. We're really blown away that we had such engagement. Thank you for everything that you do as our most valued supporters. Literally everything we've talked through today is because of your generosity and ongoing support. We couldn't do what we do without you. I hope you found this afternoon as thought-provoking, and I have. Please do share any thoughts or reflections with us. We're keen to make these sessions work for you as best as we can, because I know there has been such an overwhelming response. If you'd like us to hold another talking point on mental health, do just let us know. We can have another deep dive session into it. March's talking point is going to tie in with Mother's Day, where we'll be focusing on how we work with young mums in the Centrepoint family. So please do watch out for that email and join us if you can. But all that's left for me to do is say thank you again for everything that you do and everything that you will do. Thank you to Sue for being such a brilliant panelist. And everyone, I wish you a brilliant afternoon. Take care. Bye-bye.